Once again, we just have a lot of new people just joined this workshops. Hello again. Today we have a webinar from Chinese Renal Associations, part of the Kidney Foundations of Canada. Today we are going to cover the treatment options for kidney failure. The webinar itself takes about 1 hour from 2 o'clock to 3 o'clock. We are still admitting people from the lobby to the webinar at this point. So if you just joined the webinar, please mute yourself. During this 1 hour webinar, we will cover a lot of information about kidney disease and also the treatments. And we will be also using the chat functions to share some information about kidney foundations and also Chinese Renal Associations. During the presentation today, we also have polling questions for the audience, just for us to understand what you know about kidney disease. And please feel free to answer those questions accordingly. And again, we have interpretation services available today. This workshop is delivered both in English and Mandarin. And the slides itself will be in simplified Chinese for today. So that it will be easier for some of you to also look at the screen and have a better understanding if you are having difficulties with the audio. So we're gonna wait for a couple, it's 2 o'clock right now. We're gonna wait for 1 to 2 more minutes. We still have some people in the lobby. So let us admit all those people before we can officially begin the series. Okay. 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 Begin the workshop for today. Good afternoon, everyone. Thank you for spending the time with us or with us on a Saturday. So my name is Alan. I'm the chair of the Chinese Renal Associations, also part of the Kidney Foundations of Canada. So today we are very happy to have Dr. Mushi with us to talk about the treatment options for kidney failure. And before we start, I would like to share some housekeeping information with some of you. So again, today we will be using the Zoom platform and including the chat function and the polling functions. We will be using the chat function to share some of the information about kidney foundations and also Chinese Renal Associations. And later on during the presentations, we will also have polling questions for the audience on it as well. The format of the presentation today will begin with presentation by Dr. Mushis, and in the last 15 to 20 minutes, we will also have a live Q&A questions, and also we will be answering some of the questions that we have received during the registration as well. So if you have any questions, feel free to type it in the chat box so that we can all share and also learn from each other. And to begin with, for you to know what is to learn more about our organization. So Chinese Renal Association was founded in 1997. We are now part of the Kidney Foundation of Canada in Ontario branch. We are actually all volunteers in Toronto who are committed to provide education, information, and support to the Chinese communities. And CRA includes doctors, nurses, social workers, dietitians, healthcare worker, patients, and caregivers. And in the past, we have hosted lots of public events, including Kidney Awareness Day, Chinese New Year dinner, fundraising concerts, and many other education workshops as well. And once again, if you haven't checked out the Zoom function for today, again, we have interpretation services. So you will notice there should be an icon look like this. And you can also change it to Mandarin or English, depends on what language you would like to prefer for today's sessions. And again, we have a website, our kidney.ca, our website, and you will notice this page. And this page provides a lot of information about kidney disease and what are some of the programs and services that are available to the public. Please feel free to check out this website, and I will share the link in the chat box later on. And so now let's talk about Dr. Mushi, our main speaker. So Dr. Mushi is here with us today, and he is a clinician investigator, transplant nephrologist at the Ajmer Transplant Center and Divisions of Nephrology at the University Health Network, UHN. He is also an associate professor of medicine at University of Toronto. He works with Chinese, African, Canadian, and South Asian organizations and communities to understand and reduce barriers and inequities in accessing kidney transplantations and living donor kidney transplantations. So through these partnerships, his research will help us to better understand the barrier that patients face when they need advanced kidney care, specifically kidney transplantations and live donor kidney transplant. His project also aimed to improve understanding and managing kidney health in general for the patient from diverse communities. He's also leading research project to measure physical and emotional symptoms such as pain, fatigue, depression, anxiety, and sleep problems that are important determinants of quality of life of patients with kidney disease. His team is building an electronic toolkit for the measurement of these symptoms and an online resource hub for patients and families to support self-management and of these symptoms. And as of today, Dr. Mushi has published more than 160 peer-reviewed articles. So I will now pass the Zoom to Dr. Mushi, and so that he can share his screen. So Dr. Mushi.
Good afternoon, everybody. Do you see my slides, the first slide?
Yes. Yeah.
Okay. Thank you very much for the introduction. Thank you very much for the invitation to present or to have a discussion about kidney disease and treatment for kidney failure today. I'm very happy to have this opportunity, and I hope that this will be a lively discussion. So feel free to use both the poll questions when we go through the slide, and also the chat box for the questions. I'm a transplant nephrologist, as Alan mentioned, at the University Health Network. I've been doing kidney transplantation for 10 years, following patients after transplant, and also assessing patients who want a kidney transplant. Before that, I had been working in general kidney clinics and dialysis units, both in Hungary and in Canada. So today, we will be talking about 4 topics broadly. I hope that many of you have heard Dr. Ting last week talking about issues related to kidney disease, chronic kidney disease. Therefore, I will not spend too much time on that. I will very briefly review some of the key features of chronic kidney disease. And I will spend most of the time talking about kidney transplantation and living donor transplantation. And at the end, I will briefly mention a research project that Alan also mentioned that is looking at barriers to kidney transplantation and living donor kidney transplantation for patients from various communities. First, let's start with the most basic information about the kidneys. What do the kidneys do, and actually how many do we have? Most of us will be born with two kidneys that are located at the back of our abdomen, or outside, just outside the abdomen, below the rib cage. And the kidneys are extremely important organs because basically they keep the blood clean. They keep the balance of our body by removing toxins, removing waste that is not needed, and that would make us sick if the kidneys would not work. Other than this cleaning function, though, the kidneys do a lot of other things as well. They produce hormones to control blood pressure, also to help the bone marrow to produce blood. Also, the kidneys are very important in maintaining our bone health. Without kidney function, the bones will become weak and fragile. So you can see that once the kidneys are weak, when they are not functioning well, all of these function will get weaker or will disappear, will not work properly, and there will be eventually a lot of negative consequences to our health and well-being. So what do we mean when we say chronic kidney disease? There are many different forms of kidney disease. Some of them are so-called acute, for example, an infection that comes and can be treated very quickly, and it would go away, and the kidney can get infected. However, when we talk about chronic kidney disease, we talk about a long-standing process where the kidneys are sickened by either diabetes, high blood pressure, inflammation, or other illnesses. And importantly, once these conditions started to damage the kidneys, the kidney function will eventually slowly or more rapidly decline, and the kidney function will become weaker and weaker. And this is what we call chronic kidney disease. This usually lasts for years or happens through years, over years. And once the kidney function goes down to about 15% of normal, this is the stage that we call either end-stage kidney disease or kidney failure. And usually below this 10–15% of kidney function, the person will be quite unwell and sick, and they will need kidney replacement treatment, which is either kidney transplantation or dialysis to stay alive and to be able to function properly. So as I will discuss later, it's not always very easy to know if you have kidney disease or not, because kidney disease doesn't have symptoms early on. Therefore, it's important for us to talk about the risk factors of kidney disease, because when you have a risk factor, it doesn't mean that you have the kidney disease or you will have a kidney disease, but it's important that you keep on checking your kidney function or ask your family doctor to check your kidney function regularly. So the main risk factors for kidney disease are diabetes, obesity, high blood pressure, and also if you have kidney disease in the family, or if you have heart disease, or even smoking actually can be harmful for the kidney. But most importantly, diabetes and high blood pressure are the key risk factors. This is very important to know, both because they are the most frequent risk factors, but also because they are very frequent in the population. There are many people who live with diabetes or high blood pressure, and it's important to know that you are at risk to develop kidney disease. About half of the patients who require dialysis or kidney transplant now in Ontario, they have kidney failure because of diabetes and high blood pressure. So as I mentioned, this is important to know and remember, because kidney disease early on will have no symptoms. You wouldn't know unless you go and test for it. As I mentioned, the chronic kidney disease that comes from diabetes or high blood pressure or other inflammatory diseases will not go away. Once the kidney function is damaged, it will not heal completely. What we can do with the treatment, though, we can slow down the progression. As it's pointed out in the slide, early kidney disease can be treated, and the earlier you start focusing on the kidney function and managing the kidney disease, the better it is, the more results we can achieve. And it's important because early kidney disease can progress to kidney failure, which will then need dialysis or kidney transplant, which are quite serious conditions and treatments overall. So I'm emphasizing that you need to look for the kidney disease because otherwise you wouldn't know. How can you do that? It requires both blood testing and urine testing to know if your kidneys are healthy. So it is important, especially if you have risk factors for kidney disease, such as diabetes or high blood pressure or others, or if you know that family members have kidney disease. It's important to have the kidney function tested, both doing urine tests and blood tests. There are different pieces of information that you can get from these tests, but both of them are needed to establish or to understand if your kidneys are healthy or maybe early signs of kidney disease show up. And so this can only be done in a laboratory. So when you go to your family doctor, definitely, even for completely healthy individuals, even if you don't have risk factors for kidney disease, it's worthwhile to have your blood pressure and the blood sugar checked once in a while at your annual physical, and also your kidney function, which is from the blood and the urine. Importantly, the urine test is essential for establishing diabetic kidney disease, because that may be the first and only sign. The blood work can be still completely normal, but some protein may show up in the urine that indicates that, well, there might be a bit of an early kidney involvement from diabetes. And if you start to act there, if you start to treat and manage your kidney disease at that earliest point, you can achieve the most result from the treatment. So if you have risk factors, or if you know that you have some degree of kidney disease already, what can you do? A lot of this has been discussed in detail by Dr. Ting last week, but very quickly, one of the most important piece, if you have kidney disease or if you have risk for kidney disease, you need to have your blood pressure controlled, normalized. Blood pressure within limits, the lower the blood pressure, the better it is for your heart and for your kidney and for your brain. So again, this is something that you need to measure. It's good to measure it at home. That's more accurate even than in the office of the family doctor or in the hospital. So if you measure your blood pressure, it must be less than 140 over 90 most of the time. Occasionally, it may be a bit higher, but most of the time, it should be less than 140 over 90. Ideally, especially if you have diabetes, your blood pressure should be even lower. It should be around 120 over 80, 120 over 85. So this kidney function will need to be checked and tested regularly together with the blood pressure. Of course, if you have diabetes, the blood sugar will need to be tested as well. And it has to be well controlled with medication and diet. And importantly, and then we can talk about that later, healthy eating, physical activity is quite important for kidney failure, kidney disease, and also the risk factors such as diabetes and obesity, of course. Healthy eating can reduce your weight if you have extra weight. And if your weight goes down, diabetes sometimes goes away or gets better. And even the kidney will feel better if your weight is less. So I'm sorry for that. It just broke my phone. Usually the light still goes on. And importantly, if you have any underlying conditions, whether it's blood pressure, diabetes, or other conditions that may cause kidney disease, and in general, if you have medications that your family doctor or the specialist told you to take regularly for a long period of time, those need to be taken regularly to maintain health, maintain kidney health. For example, if you have high blood pressure or high blood sugar, you need to take those medications every day, all the time, even if your blood pressure is normal, to keep it normal. So it's not enough to take the blood pressure medications only if your blood pressure is high, because that still kind of results in fluctuating blood pressure that is not healthy for the kidney. So when we're talking about physical activity, of course, I'm not suggesting that everybody should be an Olympician, but different types of physical activity, having a dog, walking with the dog, doing gardening, and walking as much as possible is quite important for your overall health, your heart conditions, your heart, and also your mental function. And kidney disease. And especially this is important to mention now when we are all logged in our homes because of the COVID pandemic. It is important to find ways to try some activities, do some physical activities safely, but regularly. I always say that the staircase is the best exercise tool and the cheapest that you have. And if you have stairs that you can use them frequently, daily, it's very important for your physical fitness. And again, as mentioned, diet is quite important. What you eat defines your health. And it is particularly important also for the kidney health to eat healthy diet. When I say healthy diet, there are a number of important points to consider. First of all, we need to drink enough liquids, which includes soups, tea, coffee, water, of course, and mainly water. And the average amount that we suggest is at least 1.5, 1.5, or 2 liters, which would be 3 or 4 or a little bit more bottles of water or liquid or more. Eating more fruits and vegetables, more than meat, is also healthier for your heart and for the kidney. Eating a little bit less protein than at least usually here in the Western world people eat is healthier for the kidney. If you eat a lot of meat, that gives more work for the kidney because there's more waste products are produced from meat than from fruits and vegetables. And very importantly, both carbohydrates and sugars are that is a lot in the pop drinks, and salt, which is obviously very much contained in preserved food. So salt and sugars are quite unhealthy. Salt increases your blood pressure. It also damages your blood vessels. And sugar may contribute to weight gain, obesity, and then cause kidney diabetes, high blood pressure, and kidney disease. So of course, there's probably more to diet than that, but I will move on to the treatment of kidney disease, the treatment of kidney failure eventually. But first, I just wanted to illustrate the point of all these interventions: managing your blood pressure, managing your diabetes, eating healthy, living a healthy lifestyle on this figure. So as I mentioned, we are talking about kidney disease when your kidney function starts to decline from the 100% that is shown on this left side of this slide. And the blue line illustrates how your kidney disease, how your kidney function may change if you have diabetes and the kidney is affected by diabetes or other conditions. So as time goes on, and usually this is years, your kidney function will go from 100%, which is normal, down to 50%. And as I said, even at 50% kidney function loss, which seems to be quite much, you may not have any symptoms at all. And once the kidney function goes down to this 10–15% indicated with this star here, this is when you usually need to consider either kidney transplant or dialysis treatment. Now, as I said, treatment can help. Earlier, the better, because if you treat your diabetes well, if you treat your blood pressure well and maintain a normal blood pressure, if you eat a healthy diet, instead of this rapidly, your kidney function will remain more stable and the decline will be less fast, and you can avoid needing transplant or dialysis by years. So that's why it's so important to check your kidney function regularly if you have risk for kidney disease. and manage those conditions and keep your kidneys as healthy as possible. And these are the lines. So usually you start to feel symptoms when the kidney function is as low as 30%, indicated by this orange line. So it's quite a lot. And if you only start treating your kidneys, that will not really bring you too much benefit. So this is the first poll question. And I will ask the team to bring up the poll if possible. So the question is, do you think if dialysis, which is one form of kidney replacement, gives as much kidney function as a kidney transplant? And the first answer is yes, and the second answer is no. So if you say yes, you think that dialysis gives just as much kidney function as a kidney transplant, whereas if you say no, that indicates that in fact you think that transplant gives you more kidney function. Just give it a little bit of time to think and maybe answer. Just try to go ahead and decide. We will discuss this, but I just wanted to give everybody a chance to vote for this. So right now it seems that about 25 people from who answered things that transplant gives more function than dialysis, but about 1/3 of the respondents actually think that it's more or less the same. So we can, I will close the polling. There will be more to come. So that was the final result. About 30% thinking that the dialysis is the same as transplant. So going to this, you will have the answer here. The dialysis is actually a life-saving procedure, as we discussed, because if you have kidney failure, that's a life-threatening condition, and you need some kind of kidney replacement treatment. Dialysis can maintain your life. There are people who can work while they're doing dialysis, but it is important to know that dialysis can only give you about 5 to 10% of kidney function. So that's not a lot. You still have symptoms, and more importantly, with dialysis, you need to do a lot of work to keep that 5–10% of kidney function, because it's either through hemodialysis, that is one form of the dialysis treatment, or with peritoneal dialysis. Either way, you need to spend hours every day or every other day with doing dialysis. And this only gives you 5 to 10% of kidney function. And I will show you later, but I just give the answer now as well, that a kidney transplant will give actually much more. A kidney transplant can give you anywhere between 30 to 40 to 80 or 100% kidney function. So at least 3–4 times more kidney function than dialysis. And also you don't need to worry about it, because the kidney transplant, the graft, that does its own job, and you don't have to worry about it. Only you need to make sure that you do your testing and you take your medication. So this is the two types of dialysis on this side of the panel. This gentleman is doing hemodialysis. Usually this is done in the hospital through these machines. You need to have your blood running through this dialysis machine. So you have an access, either a fistula in your arm, which is actually a connection between your own vein and artery, or you may have a line here in your neck, which is a plastic tube that is going into a large vein in your neck. And the dialysis units in the hospitals usually look like that. There are large rooms where there are a lot of machines and a lot of chairs where people sit 3–4 hours every time they do this dialysis, three times a week or more. The other type of dialysis, peritoneal dialysis, is done at home. So you don't have to go to the hospital, only for the clinic visits. And you have a plastic tube sitting in your stomach. And through the tube, you put liquid in your belly. The liquid sits there a couple of hours, and then you drain it out into a bag, dispose it. And this is how the blood is being cleaned. The two dialysis types are usually similarly effective, so it depends on your preferences. Usually the patient preference is the main decision-making point when selecting between dialysis forms. Sometimes there are conditions that, that prevent you doing this one or the other. So this was so far about dialysis and managing the kidney disease before you need kidney replacement. And the next few minutes, I'll talk about transplantation and living donation. So importantly, what is transplantation? Transplantation is a surgery where the recipient who has an organ failure will receive that organ which is failing. There are multiple organs that can be transplanted, as we will briefly discuss. We are talking mainly about kidney transplant today, where the recipient whose kidneys are kind of indicated as being sick with this graph here, small and scarred kidneys, they don't work well. A healthy kidney from either a deceased donor or a living donor will be placed in your belly. Usually the kidneys that are not working properly are still left in place. This is for kidney failure, you have dialysis, so you have other treatments, but for other organs, transplantation may be, other organ failures, transplantation may be the only treatment to keep you alive. In Ontario, the Trillium Gift of Life Network is the organization that organizes donation. They primarily focus on deceased donation. And they work together with the Ontario Renal Network to also help and facilitate living organ donation. And just to go to the second poll, when we talk about the two treatment forms, dialysis and transplant for kidney failure, which one do you think? We said that transplant gives you more kidney function, but do you think transplant is as much better as to provide longer life? On average, maybe about 5 years longer life. Do you think this is true, or you think this is not true? Dialysis is providing as longer life as transplant would. Okay, waiting a little bit so that people who feel that they want to have their voice heard can cast their votes, but it seems that overwhelmingly respondents are saying that yes, this is true. On average, a kidney transplant provides at least 5 years longer life compared to dialysis. So I will close the poll and the results are shared. And then we can just go to the next slide. Oops, this keeps on coming back. And just very quickly talk about some other transplants as opposed to kidney, or in addition to kidney transplant. As I mentioned, there are many other organs that can be transplanted. Heart, lung, liver, pancreas can be transplanted. And for these conditions, especially for heart, lung, and liver transplant, there are no real other treatment options. So if your heart is so weak that it's not working, or lung is so weak that you can't breathe, the only treatment option there is really an organ transplant. And of course, for heart and lung, the only way that is to get from deceased donors. And it is important to consider this, because with donating or thinking about donations and signing your donor card or registering as a donor after one's death can save other people's life by providing these vital organs. And we can discuss that in a little bit later, but this is important. Also, it is important for everybody to consider, even if you think that you're not quite healthy, every potential donor who registered for donation will be assessed and tested by doctors, so they can decide whether the organs can be used or cannot. So it's important to sign up. And one important reason that everybody should consider signing up is that, as you may know, that to get a transplant, you need a matching organ. And one of the way that matching is done is by blood groups, and the blood groups will need to match for most organs. And the blood groups are not equally distributed throughout the society. So for people who actually are of Asian background, they are more likely to have blood group B compared to people from Europe. And so if mainly white people will sign up for organ donation, there will be very few blood group B organs. So people who need those blood group B organs will have to wait much longer, or they may not be able to get a transplant at all. So this is just the numbers, how many transplants are being done every year in Ontario. This is from the Trillium Gift of Life website. You can see that these numbers are being updated. So the most frequently transplanted organ is kidney. On average, 600-700 kidney transplants are being done. About half of these, or 1/3 of these transplants are from living donor. Liver and lung is also quite numerous. And then you can imagine that this many lives are being saved every year in the province. And also, as you see that in 2020, the number of transplants for pretty much all organs have been significantly less than before, and that is due to the impact of the pandemic. So what is transplant again? Specifically kidney transplant, as I said, it's a surgery. It's not a big surgery. It takes about 2-3 hours, the actual surgery. You will be admitted to the hospital. Usually you stay there for about a week. Importantly, every patient who receives a transplant will need to take anti-rejection medications as long as their organ is working. Those medications may have side effects, as I will show you, but you need to remember that staying on dialysis can also have side effects and a negative impact on your life and quality of life. In the first 2 months after transplant, you need to do blood work and clinic visits quite frequently, once or twice a week. Later on, the number of visits will be much less frequent, and after a year, you only do blood work every 2-3 months and come to the clinic maybe once or twice a year. And importantly, if your kidney is failing, or sometimes if your liver is failing that you received as a transplant, you can potentially have a second organ. So there is another question here. We discussed that kidney transplant can give you a longer life, but will it improve your quality of life? I mentioned that the anti-rejection medications may have side effects. And people sometimes are concerned that, that actually the medications will be so difficult to take that they may not even want to consider a transplant. I know that a lot of words on the screen, but maybe you can consider whether a kidney transplant gives you much better quality of life, a little bit better, or quality of life would be the same more or less with transplant compared to dialysis, or actually because of the side effects or other negative consequences from the transplant, your quality of life may be even worse. So which one you think would be true? Just give another couple of seconds. It seems that the consensus in the audience is, and actually that's more or less what we think by knowing from studies, that actually kidney transplant gives you significantly better quality of life, which is probably, I would say, it's more towards the much better compared to the little better. But of course, everybody responds differently to different treatment options. But it's very rare that people who live with a functioning kidney graft would say that they would like to go back to dialysis because their life was better. That's pretty much not the case. Although, as I mentioned, that kidney failure is a serious condition, and dialysis can help you even as well as that you can work full time. So this is a busy table, and I will not talk about this too much. The slides actually will be available as a PDF for registered participants, so you can read this, and we will be happy to answer questions. And the Kidney Foundation, the Chinese Renal Association members can also answer questions or connect with me. But there are important differences between dialysis and transplant. Dialysis can be done on the spot. Sometimes it happens that you don't really know what happens, why you're unwell, and you go to the hospital and they find out that your kidneys are not working, and you need to start doing something about it right away. And for transplant, the workup takes several months or years. So dialysis can be done immediately. You need to go to the hospital, or if you do peritoneal dialysis, you need to do it at home, but you need to spend time. Whereas with transplant, you need to spend much less time with this. You need to take medications whether you're on dialysis or transplant, regardless, but certainly people think that the anti-rejection medications are maybe more potent and they may have more side effects. Importantly, if you're doing dialysis, you can't really travel, you cannot eat and drink what you want or what you would like to. And some restrictions may be applicable for transplant as well, but other than just eating a healthy diet, as we discussed at the beginning of this talk, there are no real drinking or eating restrictions with transplant. And usually transplant gives you more function and much more energy, better sleep, and less symptoms. So as discussed, and it is important to consider that there are two types of transplant, living donor and deceased donor transplant. Living donor transplant usually lasts longer. They work more quickly and provide more kidney function. But unfortunately, only about 1/3 of the patients who need a kidney transplant will be able to get a living donor transplant. Importantly, living donor transplant can only be done for kidneys and liver failure. And if you want a living donor transplant, it will have to be yourself or the family who will find that donor. Whereas if you're waiting for a deceased donor transplant, Trillium Gift of Life is the organization that will find that donor for you. But sometimes it takes a long time. It could take as long as 6 to 8 or even 6 to 8 years or longer. As I mentioned, you need to register for a deceased donation. If you think that you would like to donate, there is this website. When you renew your driver's license or health card, you can also complete a questionnaire. Some people are concerned that if they register for donation, they will not receive the same care in the hospital because the doctors want their organs to be transplanted. The doctors who will be treating you in the hospital, regardless why you go there, they don't know if you registered for donation or not. They will only know when your life comes to an end. So that's registering for donation is safe and secure, and it will not impact your care. It is important to emphasize that you can change your mind, you can cancel your registration, and also importantly, your family will be asked whether you registered or not. So it's important, if you think you want to donate, talk with your family, because sometimes family members don't know what you wanted or they think maybe differently. And when the doctors ask them if they are agreeable to donating, for you donating after your death, they may not know, and they may say no, whereas you wanted to say yes, for example. So this is important to have a discussion about donation in the family. Living donation, as I mentioned, usually it can be done more quickly. It comes with less complication, and overall is better. So the next question is that, well, if I'm donating a kidney while alive, I will only have one kidney. Can someone live a completely healthy life with one kidney? Yes or no? So I'll be waiting a few more seconds for more answers to come in, although again, the majority of the respondents clearly seem to say that yes, you can live a healthy life, and that is true. So interestingly, although we have two kidneys, some of us actually are born with one kidney, and sometimes it can lead to problems, but sometimes it doesn't. And people who lose their kidneys in accidents and the other kidney works, or people who donate their kidneys, for the most part, they can live a completely healthy life after donating. We discussed this already, so we skip this slide and we go to the next one. So who can be a living donor then, if this is the best treatment for kidney failure and it has very little complications for the donor? Everybody who is adult and who has an excellent health. The donor workup is very detailed. If you have underlying health conditions, you cannot donate because that may risk your own health later on, or the kidney that you're donating may be a bit impaired. Blood pressure and weight will be checked, and of course, if you have diabetes, you cannot donate. What if you're not a match? I noted that there will be a session next week about donation and pair exchange, so I don't spend much time. But even if you're not a match, there are ways to donate to your family member or friend. And so again, a question is, if living donor transplant is the best, why is it that not everybody gets a living donor? I think people may not know enough about transplantation and living donation, and they may be concerned that actually donating a kidney will bring health risks to the donor. Or sometimes it's not the donor, but the recipient who has kidney failure. They say that, well, I wouldn't accept because I don't want to risk other people's life or health. And many people would not want to be a burden. So there's a lot of reasons why either people are hesitant to donate or they are concerned to accept. There are side effects from donation and transplant, but they are very rare. Sometimes donors can develop high blood pressure. Sometimes donors who donated a life can have a preterm delivery of their baby if they're women and get pregnant after that. And very, very rarely, less than 1 in 1,000, people who donated may develop kidney disease and kidney failure, but many of those patients actually would have developed kidney failure even if they had their 2 kidneys. And the last piece, in just 1 or 2 minutes, we can spend more time in the discussion. This is our research, and as mentioned, we know that people from diverse communities have much less chance to get a living donor kidney transplant compared to white Canadians. And this is actually 50 to 70% less chance if you're African, Caribbean, Black, or Chinese than if you're a white patient with kidney failure. This is a graph from our research which shows exactly that. The top graph is the white patients, and they have much higher chance to get a living donor transplant compared to any patients coming from racialized communities. And again, if we ask patients who come for assessment whether they think they have a living donor, about twice as many African or East Asian, that are mainly Chinese patients, who would say that they don't have a living donor or they wouldn't accept a living donor transplant. And why is that? This is what our research wants to understand. There was one study having focus groups and interviews with patients and families that was done in British Columbia about this issue. And they identified a number of factors that may prevent Chinese patients and donors to consider living donation. And this is described in this right panel. The left panel indicates those factors that are for the transplantation, for the living donor transplantation, that are values that are maintained highly in the Chinese community. As a balance, at the same time, it seems that actually very few patients, very few Chinese patients who are on dialysis will end up having a living donor transplant. So that's why also we think that the research is important and these discussions are important. And this is our flyer for the research. You see some details about our research project. And if you're interested, please reach out if you want to participate in an interview. And I will stop here. Thank you very much for the attention. And we will start answering questions. First, I will stop sharing my screen. And I see the panels. And I will start answering some of the...
Okay, go ahead.
Okay, yeah, sorry, I can stop and wait if there's any comments or questions now. And then we had some questions that were sent in and I can start answering those.
来问一下大家有没有任何其他的问题要问？那现在可以问，我到时候呢，现在是翻译说话，可以帮您翻译。
So, Dr. Mishi, I think there's some questions on the chat box. I think one of the very first questions that come up from the audience would be, what is renal cyst?
Okay, so a renal cyst is a little bubble in the kidney tissue that is usually seen on ultrasound or CAT scan. Usually a cyst contains liquid, fluid inside. Sometimes it may indicate kidney disease.
来，我们再讲。
If the kidney is getting weaker, more and more cysts can develop in the kidney. But there is a condition that is called polycystic kidney disease, where it's an heritable condition. About 10% of all the patients who are on dialysis have polycystic kidney disease. And in that condition, you start to have these cysts building in your kidney, and eventually those cysts kind of compress and squeeze the kidney tissue, and the kidney cannot function properly.
Thank you, Dr. Mishi. So the second question also from the audience, what is the creatinine rate?
The creatinine, it's measured in the blood, and it is a marker, an indicator for the kidney function. So creatinine is not a rate; it's the level in the blood. It's a substance in the blood, and traditionally this is what we use to measure kidney function. We now calculate this glomerular filtration rate, the GFR, from the creatinine value, and that kind of gives you the percentage of kidney function. The creatinine value should be less than 100 for healthy kidneys. Sometimes it's even much lower, and the GFR is around 100 normally, and as it goes down, it means that you have only 50% or 30% kidney function, as I said in the talk.
Well, thank you. The next, I think the next one is a comment. Is state creatinine range is 0.7 to 1.4 mg/dl.
Yeah, so that is the unit that is used in the United States. Just to make things in life more complicated, there are at least two different measures. And here in Canada, we use the measures that are used in Europe. And in that range, it is micromole per liter. And it's around between 2030 at the lowest and up to 90-100, the normal range.
Thank you. And there's a question from Connie. Is my adrenal adenoma big and need to be removed? 54 mm times 32 mm times 20 mm.
Renal adenoma?
Yeah.
So 5 centimeter, 54 millimeter, this is certainly something that will need to be assessed. You probably best talk to a urologist. There might need to be a biopsy done. If the biopsy was done and it indicated there is no cancer in that, it's probably okay to leave in. But if there is potential for cancer, then it needs to be removed. And that is decided by a specialist, a urologist, who will assess that.
And the next question would be, what are the symptoms of kidney failure?
Yes, I didn't put that slide on. And I just wanted to emphasize, as I said in the talk as well, that the kidney function can go as low as 30-40% of normals. So you can lose more than half of your kidney function and still feel okay. But once you start to develop symptoms, the first symptom may be fatigue, loss of appetite, nausea, vomiting, itchy skin, sleep problems. So these are the first ones. And of course, none of these are specific for kidney disease. So you can be fatigued chronically for various reasons. So that's why it's so difficult to know if you have kidney failure or not, but that's why it's important to check the blood and the urine.
Thank you. And the next question, I think, is more for the CRA and Kidney Foundation. So can we review today's seminar again in Kidney Foundation website? We're trying to upload it to the Kidney Foundations. However, after today's sessions, We will send you the PowerPoint slide in PDF after today's sessions. The next one is from the floor would be, is microscopic hematuria a kidney illness? What will happen if it lasts for over 10 years? Is there any treatment?
Microscopic hematuria means that there's a little bit of blood in the urine. Microscopic means that it's not visible, so the urine still looks clear, yellow. But still, if you look at the urine under the microscope, you see red cells, blood cells. What it means that it may be a sign of a kidney disease, but it may not. Sometimes the blood cells come from a different place than the kidney, and there are kidney conditions that are not really a disease, but they can have some blood in the urine. If you see red blood in the urine, of course, you need to go and see a doctor immediately. But even if you have microscopic hematuria, it's better to check for protein and measuring your kidney function. Sometimes your doctor will send you to a specialist, and you may need to have a kidney biopsy to decide what the situation may be.
Okay. Next question would be related to kidney transplant. So the rejections always happen. Does rejection always happen after kidney transplant? And if the rejection or maybe anti-rejection medicine is not working, how do they treat it?
Yeah, so rejection is actually the reaction of your body, or if your immune system, to destroy the kidney. Our immune system protects us from any invasions like bacteria or viruses. And in this case, the body would recognize that the kidney is foreign, it's not mine. So it would try to destroy that kidney. That's the rejection. But it starts slowly. A rejection doesn't mean that you lose your kidney. It means that your body started to kick that kidney out. And it doesn't happen always. In the first year, only about 1 in 10 patients who got a kidney transplant would have a rejection. Later on, this increases, but the kidneys are lost after 10, 15, 20 years because they just get tired and scarred. And if you have a rejection, usually that can be treated with more anti-rejection medications or different anti-rejection medications.
So we still have about 5 minutes left, so maybe we'll go through a couple more questions. Unfortunately, we have to stop at 3 o'clock. The next question would be, when kidney function fail, does it mean both kidneys are not working?
Yes, it's a very good question. Thank you. Yes, so usually the conditions like diabetes, inflammation, or high blood pressure affects both kidneys, and the same process goes on in both kidneys. Sometimes what happens is that if you have kidney stones and the kidney stones block the kidney, usually that happens on one side. Sometimes that kidney, if it repeatedly gets blocked, the kidney can get weak. Sometimes bad infection can damage one kidney, but usually most of the kidney diseases affect both kidneys.
Okay, next question. Is nephrotic syndrome a chronic kidney disease?
Yes, it is. Nephrotic syndrome means that you have a lot of protein in the urine. The kidney normally filters out, expels the bad stuff, and keeps back the important stuff. And protein that is circulating in our blood is important for our health, and the kidney keeps it inside. If the kidney is damaged, this is usually from inflammations, all kinds of specific diseases. Usually it's relatively rare. The kidney spills out a lot of protein. And eventually, if it lasts long, that can damage the kidney function, and you can end up having renal failure. Not necessary, but many of these conditions lead to kidney failure. And many of these conditions can be treated with medication. Sometimes it's simple medication, just blood pressure medication or similar, and diet. And sometimes it's similar medications than the anti-rejection medications.
Okay, I will take this as a last question. So does lower back soreness near kidney space have any relation to kidney disease?
Probably most of the time it doesn't. Most of the time lower back pain is either from the spine or the muscles, but sometimes it can indicate kidney disease. Usually it's kidney stones or some other conditions, but frequently kidney disease, as I said, doesn't cause pain.
So once again, thank you, Dr. Mushi, and also thank you everyone for joining today's sessions. We really appreciate Dr. Mushi for his time and also share his knowledge and also answering some of the questions about the kidney disease and also treatment. So for this, and before we finish off for today, I just want to share our next upcoming workshop, which will be on May 29, also on a Saturday from 2 o'clock to 3 o'clock. More about on the organ donation and transplant, but an additional information about when it comes to organ donation, what is going to happen, what is the procedures. And we have two wonderful speakers, Sarah from the Canadian Blood Services, and also Kaylee from Children Gift of Life Network. So during that time, we will also go through some of the more information about the transplant and organ donations. And we will send this pamphlet to you all later this week. If you're interested, please feel free to register.
Thank you very much for the interest, for the invitation, and for the many questions. And I hope this was useful. And feel free to reach out to us, for myself or the team, through the Chinese Renal Association if you have any other questions. I'm happy to answer additional questions if you email it to the team, and then we can have discussions later on. And the slides will be available, as Ellen mentioned. Thank you very much.
Thank you, everyone, and I hope everyone have a good day. Thank you. Take care.
Have a nice
Thank you. Thank you, Doctor.
Thank you.
Thank you. Thank you.